Welcome back to You Heard It Here with Dr. Gary. In today's episode, we're going to look at some patients who can feel the wax in their ears, even though it's not completely occluded. It's kind of crazy. Some patients feel it, some don't. I've seen patients where their ear is totally full and they have no idea. Other patients like this one have a small ring of wax and it just drives them nuts. Please take a minute to like and subscribe. I enjoy bringing you these videos about wax removals, other cool stuff we find in patients' ear, and other ear-related health information. With this patient, we're just going to use the Jobson horn, the video system, to remove the wax from the ear canal walls, giving us a clear view of the eardrum, providing the patient relief. Scrape everything off the ceiling and the side of the ear canal wall. We have a little bit that's going to be left on the bottom, which we'll pull out, and then we're going to move to the other ear. Last little bit down here at the bottom. Now, in these videos today, you're going to see some extra scraping in the ear canal. The reason is, with these long-time patients, they really like to make sure that everything comes out. It's almost like a funny addiction. And I can understand it because I'm the one taking it out. Here you can see there's quite a bit more wax on this side, and it comes out in one large chunk. We still have a little bit along the walls, so we're going to use the curette or the Jobson horn to remove that wax and give the patient a fresh, clean start before we see them back in 3 to 6 months. Yes, you heard me right, 3 to 6 months. This particular patient is seen routinely for wax removals. Not really sure why they produce so much, but they do. Alright, we're going to move on here to the second patient, and this second patient has a little bit more earwax than the first one, but still not a complete impaction. I can understand here why they're getting occasional closure of the ear. That earwax is pretty thick, but there was a hole all the way back to the eardrum, so it was not completely occluded at this time. Now, if that wax heated up and expanded some, I understand why they could have an occlusion there, but it wasn't at the moment. We're going to use the Jobson horn or curette to remove the wax, give this patient a nice clean ear canal and a good start. We see this patient about every year to year and a half. It's really important that if you're not sure what your ears look like, that you get them checked out. Make sure that your primary care doctor is looking at your physicals and things like that. If they say you're full of wax, get it taken care of. And there's the ear canal. A little bit red, but nothing really to worry about. Removing a little bit more from the ceiling, then we'll go on to the other ear. Alright, on this side, this is probably the most impacted that we have in today's episode. You can only see one little hole that the sound can get through to get back to the eardrum. This was truly an impacted ear, but again, there was still that little air pocket for the sound to make it through. We're going to get this removed, and the patient's going to report increased hearing, reduced fullness, and overall better comfort. Now again, with this patient, you're seeing quite a bit of additional scraping because they are really big on having all of it removed, and they really like the video system being able to see it. With the consistency of this wax, I think that microsuction may actually be a little bit better, but this is where the patient really enjoys being able to watch it, so we use the curette and the video system. This has been You Heard It Here with Dr. Gary. Please take a moment to like and subscribe, and we'll see you in the next episode.